Cinnamon spice commonly used is added to sweet and savory dishes around the world. However, currently in the world, there are studies proving that cinnamon has the effect of reducing blood sugar for diabetics, which offers many health benefits, especially its ability to lower blood sugar and help control diabetes. Do you know that? Cinnamon is an aromatic spice derived from the bark of certain Cinnamomum plants. To obtain cinnamon, the inner bark of the Cinnamomum plant must be removed. The bark of this tree then undergoes a drying process which makes it curl. It can also be further processed into powdered cinnamon. How does cinnamon work to reduce blood sugar for diabetics? Cinnamon contains many antioxidants. Although cinnamon does not contain many vitamins or minerals, it does contain a large amount of antioxidants that provide health benefits. In fact, a group of scientists compared the antioxidant capabilities of 26 different herbs and spices and concluded that has the second highest amount of antioxidants among them. Antioxidants are important because it helps the body reduce oxidative stress, a type of cell damage caused by free radicals. One study found that consuming 500 milligrams of cinnamon extract per day for 12 weeks which reduced oxidative stress in people with prediabetes by 14%. This makes sense, since oxidative stress is associated with the development of nearly every chronic disease, including type 2 diabetes. Cinnamon has insulin-like effects and increases insulin sensitivity. People with diabetes, the pancreas cannot produce enough insulin or the cells do not respond to insulin, leading to high blood sugar. Cinnamon can help lower blood sugar and fight diabetes by mimicking the effects of insulin and increasing the transport of glucose into cells. It may also help lower blood sugar by increasing insulin sensitivity, making it more effective for insulin to move glucose into cells. In 2012 study by Hone published in Nutrition 2012, found that taking this once after a short-term intake of 1.5 grams of sugar per day can lead to a reduction in blood sugar levels. Participants who consumed them in combination with a diabetic's diet had lower blood sugar levels than those who did not. Cinnamon even helped diabetics lower their blood sugar to normal levels during the study. It can also significantly help people with type 2 diabetes improve their ability to respond to insulin, and thus normalize their insulin resistance, which is an important risk factor for diabetes. This can also reduce insulin resistance, which has been shown to reduce fasting tissue blood sugar levels by up to 29%, reducing cases of type 1 diabetes, according to a study published in the Journal of Diabetes Care. Cinnamon lower fasting blood sugar and may lower HbA1c. Several controlled studies have proven that cinnamon is effective in reducing fasting blood sugar. A review of 543 people with type 2 diabetes found that taking cinnamon was associated with an average reduction of blood sugar by more than 24 mg dl, 1.33 mmol/L. The authors reviewed 11 studies with cinnamon therapy in diabetes, which caused a decrease in blood sugar levels during fasting. One, published in the journal Diabetes Care, found how people with type 2 diabetes who ate 1 or more grams of them which were more likely to have diabetes. Daily fasting sugar levels dropped by a whopping 20% compared to people who did not eat cinnamon. Cinnamon works to lower blood sugar after meals. Depending on the diet and the amount of carbs you eat, your blood sugar can go up after eating. These changes in blood sugar can increase oxidative stress and inflammation, which tends to cause a lot of damage to the body's cells and put the body at risk for chronic disease. Cinnamon can help control the post-meal spike in blood sugar. Some researchers claim that cinnamon does this by slowing the speed at which food is moved out of the stomach. Other studies have shown that it may lower post-meal blood sugar levels by blocking digestive enzymes from breaking down carbs in the small intestine. Cinnamon can reduce the risk of common diabetes complications. Cinnamon not only lowers fasting blood sugar and lowers blood sugar after meals. It can also reduce the risk of diabetes complications. People with diabetes are at double the risk of developing cardiovascular disease compared to the average person. Cinnamon may help reduce this risk by improving risk factors for heart disease. Additionally, diabetes can also affect the development of Alzheimer's and other dementia, with many now calling Alzheimer's disease type 3 diabetes. Studies show that it can reduce the ability of two proteins, beta-amyloid and tau, which are involved in the development of Alzheimer's disease. Some notes when using cinnamon. Cinnamon also contains a highly harmful substance called coumarin, an organic substance found in many plants. People with diabetes taking medications or insulin should be careful when adding cinnamon to their daily use. The addition of them to the treatment of diabetes puts the body at risk for hypoglycemia. The benefits of cinnamon for lowering blood sugar have been well researched. However, there are still no accurate measurements on how much to use to achieve the benefits and avoid potential risks. In addition, some studies have shown that the coumarin content of cinnamon may vary. Therefore, it is possible to consume 1 to 2 teaspoons 6 grams per day to avoid high coumarin content.